Hello, my name is Jessica and I'm your bariatric coordinator. I help facilitate the bariatric program for Dr. Pressett and our entire weight loss center team. I'm here to help you with scheduling, payments, and insurance options. At Castleview, we offer a comprehensive bariatric treatment program with or without surgery, while recognizing the emotional aspects of the disease state of obesity. Our program includes healthy lifestyle counseling, behavioral counseling, diabetic counseling, insurance advisement, information and education seminars, and support groups. We know the causes of obesity are multifactorial. Typically, the causes are seen as eating too many calories, both in volume and food type, or not getting enough physical activity. However, we know that these are also factors regarding our weight. We can't modify genes, but we can modify metabolism, behavior, environment, culture, and socioeconomic status. Our program takes all these factors into consideration. Weight loss options. There are conventional methods, diet, exercise, behavioral modification, and anti-obesity drugs, which we do not use in our practice. The other option, which we will continue to discuss, is surgery. Why surgery? Surgery is the most useful tool for long-term success, in addition to diet and exercise. Quality of life improves, and there are social and emotional benefits. The benefits of surgery can outweigh the risk of surgery and the risk of remaining obese. Meet our providers. Dr. John Pressett is fellowship trained in minimally invasive bariatric surgery. He is kind, compassionate, and understands the struggles and health risks associated with obesity. Chris Chamberlain, our nurse practitioner, comes to us with years of operating room experience. He's a great asset to our patient care team, both in the OR and in our clinic. Meet our weight loss center support team. I, as I mentioned before, am your bariatric coordinator. We have our clinic nurse, Stephanie, your exercise and nutrition counselor, who is also a certified bariatric nurse. We have a behavioral counselor, a diabetic counselor, a dietitian, physical therapy, office staff, and hospital support staff, all of which are available to you throughout your weight loss program. Throughout this presentation, we will go into detail about both the non-surgical and the surgical weight loss programs.
Hi, my name is Stephanie. I am your exercise and nutrition counselor and will be a guide for you throughout your weight loss program. I am a certified bariatric nurse and I studied exercise science and nutrition at the University of Utah. I have over 15 years experience to serve you with and am passionate about helping change lives through healthy living. At Castleview Weight Loss Center, we offer comprehensive treatment and healthy lifestyle education. We provide in-depth, one-on-one attention or small groups and individualized goals. We review your medical, nutritional, behavioral, and exercise history. Within your healthy lifestyle education, I will provide you with personalized meal plans and exercise goals. The Diet Master program, which is a website and app for food and exercise logging and weight loss tracking, allows me to provide you with ongoing supervision. As you log your food and exercise, I can check on your progress anytime from the office and provide feedback in between appointments to help keep you on track. Another key to long-term success is learning the self-management tools to maintain your weight loss. We take pride in our patients learning and understanding the behaviors that help you achieve your weight loss goals, and it is important to us that you know how to utilize these habits for the rest of your life. Accountability is paramount to achieving any goal, and our expert team will be there to support and encourage you in every step of your weight loss journey. Our non-surgical weight loss program includes your series of one-on-one nutrition and exercise counseling, behavioral counseling, and diabetic counseling if needed. You will receive a membership to our state-of-the-art exercise and pool facility at the Jeff Manley Wellness Center for the length of your program. The Diet Master website and app will be available to you throughout your program and for up to 1 year after you complete your weight loss program. Many of our patients enjoy and rely upon our monthly support groups as well, and these are open to you and your loved ones for life. Castleview Weight Loss Center provides a high-intensity, non-surgical program for long-term weight loss success. We start with a medical clearance to ensure that you are healthy enough to exercise and medically eligible to participate. We currently offer a 3 or a 6-month non-surgical weight loss program. The nutrition and exercise counseling consists of bi-weekly, one-on-one appointments for approximately 1 hour to give you the individualized plans and attention you deserve, and we offer affordable payment plans. Why should you participate in a non-surgical weight loss program? Through your participation in healthy lifestyle counseling and guided development of healthy eating and exercise habits, you will enjoy lifelong benefits for you and your family. If you don't qualify or are undecided regarding surgery, you can start the non-surgical program since it uses the same process preoperatively as the surgical track, and you may switch from one program to another at any time.
Hello, I'm Dr. John Pressett. I'm a bariatric trained surgeon and the medical director here at Castleview Weight Loss Center. I've been trained in general surgery and minimally invasive surgery with an interest in providing weight loss surgeries for patients. Here at the Weight Loss Center, I provide surgical education and information for you to see if surgery is the right thing. We're going to talk to you about the different aspects of the surgical tract of the Weight Loss Center and help answer some of the questions you may have before we meet in person. To explain a little bit more about the weight loss program and what it is, I'd like to first mention that it is a comprehensive multidisciplinary approach to helping you not only lose weight, but find ways to maintain that weight loss throughout the rest of your life. It does involve similar components as the behavioral tract that has been mentioned, with the exercise and nutrition, counseling, the evaluations, and the support groups, and most importantly, that long-term follow-up as you need it to maintain that success. The goals that we have here at the surgical program are to help you first decide if surgery is going to be the right thing for you, and then helping you work on those behavioral changes that will provide you success as you undergo surgery and as you find success following surgery. Really, we are here to help support those new eating and exercise habits to help improve your lifestyle to maintain success. Here at Castleview Hospital, we have developed a weight loss center to provide all aspects of the care that you will need to achieve success and to maintain safe throughout your surgical experience. We have an excellent and expert inpatient and outpatient team established to provide that care. We have the medical team available, the psychological and nutritional support that you will need to help with each aspect of your care. We also have the activity program, including the wellness center and the facilities that are available to help you as you begin and maintain that exercise routine. First and foremost with surgery, we have to decide if surgery is going to be the right thing for you and if it is even an option. There are guidelines that we follow and that are established as criteria back in the 1990s. First of all, the main criteria starts with what is called a body mass index, or BMI. The BMI that qualifies a patient for surgery is that of 40 or greater. With those that have a BMI of 35 to 40, surgery is still an option, but there need to be documentation of other weight-related illnesses that are consistent with being ill because of being overweight. These include illnesses such as diabetes, high blood pressure, sleep apnea, or other weight-related medical problems. Also, insurance providers may have specific criteria that need to be met prior to surgery. Simply, a body mass index is calculated by taking your weight in kilograms and dividing it by your height in meters squared. This is where the criteria is set up, with the morbid obesity being that of a BMI of 40 or greater. And just as the behavioral tract, we have the steps set up for you to be able to begin with the program and make it through to surgery and then on to success. The steps are very similar, with first starting with this orientation, either online or in person. The surgical and medical evaluations, as well as psychological and nutrition evaluations. It ultimately ends with a discussion and scheduling of surgery. After undergoing surgery, there is lifelong follow-up. Most patients spend around 3 to 6 months in preparation prior to scheduling surgery. The goals of weight loss surgery are that of permanent and maintained weight loss, improving the medical problems that exist with being obese, increasing life expectancy, and certainly improving the quality of life overall. There are many medical issues that are consistent with obesity. Many develop over time as we gain weight, but with weight loss surgery, we expect to see improvement, if not resolution, of many of these conditions that can exist. To explain more about surgery, first I would like to explain more about the normal anatomy of the gastrointestinal system. As you can see in this caricature picture, we have an esophagus that carries food down into our stomach. The stomach is a large reservoir. You can see as the arrow shows the stomach pouch itself. This large reservoir fills as we eat and eventually sends us sensations of fullness before food is sent down through the GI system. With weight loss surgery, we have several methods of changing the gastrointestinal tract to provide different results, ultimately resulting in weight loss. Gastric bypass surgery has been done since the 1960s. For multiple decades, the surgery has largely remained the same with excellent results. This goes to prove that it has very good benefit and the risks are minimal or low enough that it does provide benefit to patients. With gastric bypass surgery, the old stomach stays in place and a smaller pouch of stomach is created at the top. You can see with this small pouch of stomach that remains, it is connected to bowel from lower down in the gastrointestinal tract, and the system is reconnected down lower. This provides excellent restrictions of the amounts of food that people eat before feeling full, or the word you may hear of satiety. There are favorable changes with the hormones that are sent as signals as we begin to eat food that work together to provide significant long-term weight loss. Another option for weight loss surgery has been an adjustable gastric band. These were placed in high numbers throughout the turn of the century, first being FDA approved in 2001. The gastric band works purely restrictive in how it provides benefit to patients to try and lose weight. You can think of it as a speed bump at the bottom of your esophagus to help slow down your eating and hopefully provide that feeling of fullness before eating large amounts of food. The results are certainly much more variable than bypass. At our weight loss center, we are not currently offering adjustable gastric bands, but they do provide information for us in comparison to help patients recognize the risks and benefits. Another option for weight loss surgery that we do offer here at the Castleview Weight Loss Center is the laparoscopic sleeve gastrectomy. With this surgery, we fashion a small sleeve from the large reservoir of stomach, much like a banana rather than a large pouch. Currently, it is the most frequently performed surgery for weight loss in the country. It was approved by Medicare and Medicaid as an option for weight loss surgery in 2012. Most insurances are now covering the surgery, therefore we've seen large increases in the number. This is twofold. One, that it is now provided by insurance as an option, but more so, it provides extreme benefits, much like we see with gastric bypass, with a much lower risk profile of having the surgery, much like gastric banding. We see changes with the gastrointestinal system, much like we see with gastric bypass, that provide both restriction and hormone changes that provide benefit for weight loss. There is also benefit in that the system is not rerouted and we have less concern about certain medications that you may be taking, specifically that of steroids or anti-inflammatory medications that may be necessary. As we compare weight loss surgeries and the results that we see from them, we have information from each of these, long-term from gastric bypass and somewhat long-term from banding, and more short-term information as sleeves have not been as readily available for as long. Patients expect to lose around 60 to 80% of the excess weight with maintenance of at least 50% at 10 years. Gastric banding, we see much lower amount of weight loss, somewhere in the range of 30 to 50% of the excess body weight, and much lower maintenance of that weight loss. Sleeve gastrectomy weight loss is typically closer to that of gastric bypass rather than that of gastric banding. It is certainly important to remember that there are variables in any patient's care and in what results will be after weight loss surgery. It does vary from person to person, but typically we can expect to see the amount of weight you're going to lose reached within 1 to 2 years after surgery. Some weight regain is common, but surgery alone will not guarantee success. To help give a general idea of the care that you will expect after surgery. First, expecting a hospital stay after surgery. Typically, patients will stay on average 2 nights after their surgical procedure. You may be out of work for up to 6 weeks after surgery, depending on the type of work you do and the availability of that medical leave. Many patients can and often return to work within 1 to 2 weeks after leaving the hospital. Other generalizations to help you understand changes to expect are 5 meals throughout the day without skipping meals, eating slower and having the need to eat slower because of the surgical procedure, focusing on having protein in each of the meals that you take, as well as having plenty of fluid to stay hydrated. In general, depending on your height and weight, patients need around 40 ounces of water or fluid throughout the day and a goal of 40 to 60 grams of protein throughout the day. After bypass surgery, there are differences that may make eating sweets or alcohol cause adverse effects. These effects are called dumping syndrome. Patients who experience this often experience it because they've had too many simple sugars at one time, and it causes bloating, abdominal cramping, and diarrhea with follow-up effects that are much like flu-like symptoms for a short duration. Vitamins and minerals are an important component to weight loss surgery. With gastric bypass, it is essential that patients continue taking vitamin supplementation to help assist with the decreased absorption of these micronutrients, whereas with sleeve gastrectomy, they are not essential. Vitamins include both a multivitamin as well as iron, calcium, vitamin D, and vitamin B12. There are other supplements that can be taken to help assist with some of the concerns that patients may have, such as with hair loss or weakened nails, and vitamins including biotin and zinc become very helpful. There are complications that accompany any surgical procedure. In regard to weight loss surgery, much like other procedures, risks are higher for older or more medically ill patients. Risks are decreased by losing weight prior to surgery, and as part of your weight loss center experience, your individual risk will be addressed in your individual meetings. As we discuss complications that can occur, there are complications both short-term, meaning right at the time of surgery or shortly thereafter, as well as long-term complications that you may hear about. These complications will be discussed in greater detail as we meet individually and discuss the specific surgery that you are desiring to undergo. These are examples of some of the complications that we may discuss as we meet one-on-one to discuss surgery. These complications may occur down the road or long-term after surgery. With all surgical procedures, follow-up is very important. The care that you will receive after weight loss surgery is comprehensive. It does include physician availability 24 hours a day, 7 days a week. We have routine follow-up appointments, that initial post-operative follow-up appointment, and then a schedule of appointments thereafter depending on your needs, usually 6 weeks and 6 months after surgery. We also have support groups available, as well as the ongoing nutrition and exercise programs for your individual needs and individualized appointments depending upon those needs that you have after surgery. I also certainly recommend investigating these surgeries and obtaining as much information as possible. Some of the websites available that provide excellent comprehensive information are listed below. For other information, we are happy to provide other resources or information as you have specific questions or have desires to learn more about specific surgeries. Following weight loss surgery, pregnancy is certainly an option. We do ask those individuals desiring to become pregnant to wait for at least 2 years after gastric bypass or sleeve gastrectomy surgery. Many ask questions about the need to quit smoking prior to surgery. Quitting smoking permanently is essential prior to undergoing weight loss surgery. Smoking increases the risks of complication during surgery. It also increases the risks of complications long-term after surgery. Being able to quit smoking prior to surgery is an excellent predictor of success, both because of the commitment and determination, but also because of that overall lifestyle change that will help with your health long-term. In summary, it is important to remember that not everyone is a candidate for surgery, and surgery may not be the right treatment for you. Treatment does not end with bariatric surgery. It is merely the beginning and an important step to provide you the success in long-term permanent weight loss. It does take a team approach to be successful with weight loss surgery. We have the professionals available and here to work with you to help provide you that success. Weight loss surgery is a tool that will help you to realize the success that you're seeking in weight loss. Insurance coverage is an important topic to discuss as we discuss weight loss surgery. Most insurances do cover weight loss surgery. Many of these insurances have specific requirements, and co-payments and deductibles may apply in preparation for surgery. It is important that we contact your insurance provider to learn about your individual requirements and the benefits that are available for you. Some policies exclude specific procedures of weight loss surgery. Others require specific programs before becoming eligible to undergo weight loss surgery. It is important that we understand your coverage before you begin the process, so you know the requirements that we will need to meet to ultimately get you through surgery. I appreciate the time that you've spent learning about bariatric surgery. Hopefully this provides general information and answers some of the questions you may have before you begin your journey with weight loss, either surgical or non-surgical. Please click on the link following this page and fill out the information. As you submit that will allow us to contact you and see how we can best help you with our weight loss center.